Welcome back to another set of 10 drugs for your top 100 project. So let's get started. First up is fluticasone. This is a corticosteroid which is primarily used for inflammation, and I put two brands up here because they're different routes. We have Flonase, which is an intranasal medication. Fluticasone, you can actually get this over the counter and you can get it by prescription. It went over the counter a few years ago at the exact same strength, 50 micrograms per spray, and that caused a lot of insurances not to pay for it. So unfortunately, that became a problem, but it happens. It's off patent and we still carry it by prescription. Either way, if your doctor orders this, you may or may not get your insurance to cover it, but you can still buy it over the counter if you need to. The other one here is called Flovent, and Flovent is also fluticasone. It comes in a couple of different strengths, and this is anti-inflammatory. It's used for different types of breathing disorders. A lot of times it's used for COPD, which is chronic obstructive pulmonary disease, and asthma. It's not going to work right away. That's very important to know. This is not a rescue inhaler. It's not going to get someone out of an asthma attack. The other very important thing to know about Flovent is after use, a person using this needs to rinse their mouth, and that's because corticosteroids often disrupt the natural flora. So we have bacteria and other organisms in our mouth, and corticosteroids often disrupt that, so you can end up with an overgrowth of yeast, and that is related to fungus. You can get that kind of infection in your mouth. It shows up and presents as white patches on the tongue and roof of the mouth. It's very painful, and that's what one of the side effects of corticosteroids, really, no matter where you use it. Although I haven't really heard of it in the nose, but I have heard of corticosteroids doing this on your skin. So it kind of isn't great for healing. So if you have an infection already going on and you keep using a corticosteroid with it, you're going to have problems. So there's a lot of side effects to corticosteroids. And when we talk about another SONE, prednisone, I will give you a list of lots of side effects, because when you take it as a pill, there's a lot. So next up is Celexa. And Celexa, generic name is citalopram. Say it with me. Citalopram. It's an antidepressant in the category of selective serotonin reuptake inhibitor. And you're going to use that word a lot. SSRI is the abbreviation. You'll see there's a lot of SSRIs in the top 100 because it's prescribed widely. It does take weeks, just like the other ones we talked about. I think, did we already talk about Zoloft or sertraline? Every SSRI is going to take weeks. So you can just put that down in your grid for every single SSRI you see. It's going to take weeks or more for full effect, okay? And they all have the same boxed warning, which is suicidal risk in teens and young adults. So if the symptoms worsen and they're on an antidepressant, that's bad news. So they need to, if they're calling your office and they need an appointment, do everything you can to get them an appointment, okay? All right, up next is Pravachol. And Pravachol is the brand name for pravastatin. That is another statin for hyperlipidemia, and that is for cholesterol. Okay, we want to lower your cholesterol. So like all the statins, avoid grapefruit. Monitor liver enzymes. Now this is one of those that's bedtime dosing. So that's important. It's not prescribed as much. A lot of people that are on this one were started on it a long time ago, 30 years ago, and it works for them and they're still on it and they're not having side effects. Oh, one of the other side effects of statins, and I may not have put it here, but it's less common, but when it happens, it's serious. It's a muscle pain and rhabdomyolysis. If you're ambitious, look that up. It's rare, but if it happens, it's super serious. RHABO. Okay, that's how it starts. All right, let's move on. We've got Xanax up next. Now, look at the label closely. What do you see there? Roman numeral 4, inside of a C, it's a controlled substance, okay? This is alprazolam. It's a benzodiazepine. You're going to see a lot of zolams, clonazepam, they all end in AM anyway. Diazepam, alprazolam, they rhyme. Temazepam, and maybe another midazolam. You would not see that one in outpatient pharmacy. You would see that in like hospital pharmacy. They use that before you have anesthesia as an injection. Lorazepam, lots of those. Benzodiazepines, and it's used for anxiety, panic, and you often will see this given to a patient before they have a pre-dental work. Before they have dental work, they'll take it 30 minutes ahead of time, maybe 30 minutes before an MRI, and it is shorter acting, which is why it works great if you're having a procedure. You know, like the other benzos work, they take a little longer to take effect, and they also they last a lot longer, and procedures don't really last that long, so we don't need to give you one that lasts for 8 hours. So this is going to last 4 to 6 hours. So that's the big key with Xanax. A controlled substance, the shortest acting of all the benzos, and a box warning. So anybody on a benzo, this is really important, because if you're working in a doctor's office and your patient needs a refill on it and they're not abusing this, because it is that's one of the other potential box warnings here, is that it can be highly addictive. You'll know because the patient will be calling early all the time for more refills, and they might be they lose it all the time, it's stolen all the time, but they can't show you a police report. Patients do lose their medication once. Patients might once drop it down the sink or drop it down the toilet. It's always the two places that they drop it, and then it's not usable. Although if I dropped a Xanax, I would probably take it out of the sink anyway and try to save it. But here's the thing. If your patient is using it appropriately and they do run out, it can cause a seizure for them to miss their doses, which is very dangerous. It's like the one medication you can die from withdrawal, because you could die from a seizure if you fell down, hit your head, and you're having a seizure. So it's really important that, they make their appointments and keep their appointments and take it on schedule, and don't be ordering their refills on Friday night. So anyway, when they take this with another antidepressant, like fluoxetine or sertraline, Zoloft, the one we were just talking about, Celexa, when they're in combination, you can have additive additive sedation. Okay, so it's something that can be very dangerous for some people. They can get themselves in a situation where they're driving, operating machinery being a car, whatever, and it puts them at risk. So there's what you need to know about that one. So let's look at this one. This is potassium chloride. And potassium chloride, the brand names are totally gone now, but we still call them K-Dur, especially. Doctors will write for K-Dur. And I'm going to show you a prescription in a second. Micro K is another one. That's the only one that comes under that name as 8 milliequivalents. MEQ is milliequivalents, or 8 MEQ. Okay, we may say it either way. Why do they present it that way? I don't know. They could say 600 milligrams, but the most common strength is actually 10 or 20 MEQ. And this is the abbreviation for potassium chloride. We have K+, not to be confused with vitamin K, and Cl-, which is chloride. Okay? It's used for hypo, meaning low, kalemia meaning potassium. Okay, so when a patient's lab work comes back and they're out of the normal range, I believe it's 3 to 5 is what you're going to see on the lab. The lab will also tell you if it's low or high. The patient has low. It could be very, very dangerous for their heart to be either low or high. So we have to be in this window, and some medications cause their potassium to build up. Okay. So then if we don't monitor it and patient doesn't come in for their appointments and they keep getting their potassium refilled, and they're on another medication that's increasing it, that can be dangerous. And if they don't get their lab work, you're never going to know. The boxed warning is on this one, like some of the blood pressure medicine, fetal toxicity. Okay. So let's look at a prescription. Oh, I had a little, monitor renal function. It's also important besides the potassium, because if they have chronic renal disease or anything that impairs their potassium excretion, it can build up. It's a tight balance, and patients need to understand the importance. Okay. Before we look at that prescription, I have this up for you. You can actually buy potassium over the counter. And as a pharmacist, this really makes me nervous. I have patients who will come up and say, I want to know if this interacts with any of my medications. That's a question I get several times a day. And I pull up their profile and I look. Now, I don't even look up their profile if they have potassium. The first thing I say is, does your doctor check your labs regularly? Do you have any heart conditions? Because patients will take this because, see what it says on here, potassium 99 milligrams per caplet. It's for heart health. It's not as simple as that. And it's just really irritates me because patients don't even know. If they have kidney problems, they shouldn't be taking this. And they're going to get palpitations if they start taking a lot of it. A little bit of this is 1 tablet a day for leg cramps might be okay. But if they have any kidney function problems, it's really dangerous. They shouldn't be doing this without lab work. So that's my speech on that. There's products that even are available with potassium in it, like a product called New Salt, NU Salt. So when a patient's high blood pressure, their doctor says, you got to stop the salt in your diet, it's raising your blood pressure. They will then turn to a salt substitute, which is full of potassium. That's all it is. It's a shaker with potassium chloride in it. So the education for the patient is very important about the salt substitutes. And that irritates me too. So one more thing. You might be getting calls from pharmacy and when you're working in your setting saying, can you please tell us what the patient's last potassium level was? And that's because they might be taking an ACE inhibitor or an angiotensin receptor blocker like valsartan, and the ACE inhibitor like lisinopril. When they're on that, their potassium levels can increase. So, and then when they're taking something that also increases it, like the two of them, or they add a diuretic to it, like spironolactone, that's the one I get usually several times a day, their potassium can go up. So, okay, so here's the prescription I wanted to tell you. And we're going to do a lot more of this. This is very important for you to get comfortable with. Okay. And I'm going to read it to you. This is what it would sound like if the doctor was asking you to write this down, because the doctor wants to dictate it to you. And he'll sign it, or she. Sue Doe, date of birth, May 1st, 1981. You'll look up in the chart the address and write that in. Potassium chloride, 10 MEQ, number 14, 1 POQ12H. So let's translate that, okay? Potassium chloride, 10 milli equivalents, dispense 14 tablets. And this is a Roman numeral 1. It looks like a T with a dot over it. PO, that's by mouth. So take 1 tablet by mouth, Q12H. That's every 12 hours. No refills. Okay, so there you go. All right, so next up, amoxicillin. This irritates me that it's even red. It should be dye-free. Most of them are dye-free. It's an antibiotic. Often it tastes delicious. But there are capsules, there are tablets, and there are chewables. Now, it doesn't come like this, all pink. It comes in a powder. And the pharmacy will add the water at the time of dispensing. And we do that because it has a shelf life of, this one has 14-day shelf life. And other reconstitutable oral medications will be something like 10 days, or usually 10 or 14 days. A couple things like famotidine, which is not an antibiotic, has a 30-day shelf life. So it is related to penicillin chemically. I'm going to show you something in a minute, and you'll hopefully understand. So if someone's allergic to penicillin, they have a very high chance of being allergic to amoxicillin or any cillin. All right. So I want to talk about the allergy thing in just a minute, but first I'm going to show you a video, and let's see if I can pull this up. Let me see here.
An order for amoxicillin and clavulanate. The brand name is Augmentin, and on the side are the directions how to prepare it. It says to add 84 milliliters of sterile water for reconstitution. Shake it well to wet the powder. You can add about 2/3 in the beginning, and then shake it really well, and then add the rest of it. So take it away, Diego. Making sure that all the powder is not stuck to the bottle, always a good idea. And make sure it's not on the lid. There's a seal on the inside of the bottle that he's going to remove. He's going to measure 84 milliliters of water. Looking at the meniscus, the bottom of the meniscus is at the, well, it's a little high. Pour a little bit of it out.
That's good.
Okay. And then he's going to add about 2/3. More or less. You don't have to be exact on this. You just don't want to put the whole thing in at once because the powder will puff out the top. Then we have a cap that you can use for an oral syringe, so it's an adapter cap. Making sure that all of the powder is off of the bottom. Nothing stuck to the bottom or to the lid. Water, giving it another good shake. And then it is labeled with the amount of water added to it, the date, and the best use date or beyond use date on it. It also gets a refrigerate sticker. Thank you, Diego.
Okay, let's get out of there. And so that's what it's like to mix it. Now that was Augmentin and has amoxicillin in it. Close enough. That's how it works. Okay. So there have been reports of patients receiving it unmixed. Busy pharmacy, mom goes home, doesn't realize, that it says take a teaspoon. So she takes a spoon, which, by the way, she shouldn't do. We should always be educating our patients to use an oral syringe, because you think this is 5 milliliters? This is probably a lot more. So if a patient puts that powder in their mouth, a child especially, they're going to cough. they're going to aspirate it and they're going to end up in the hospital with maybe aspiration pneumonia or something from aspirating the powders. Very dangerous. So I wanted to mention that. Okay, so let's move on to what I wanted to talk about next, which was amoxicillin allergy. So the you don't need to memorize this, but what you do need to see here is that the reason why we have what's called cross-reactivity. This here, this red part, is the beta-lactam ring, okay? And that is found here in amoxicillin. All right. So the beta-lactam ring is part of the culprit, and cephalosporins, okay, they don't end in cillin, but they have it too. And so sometimes a patient will be allergic to a cephalosporin as well. It's actually not very many, like less than 5%. But if a patient is allergic to penicillin, then we aren't really sure. Should we give them cephalosporin? We kind of have to weigh it out. What kind of reaction did they have to penicillin? That's the first question. Was it really an allergy? Oh, they had an upset stomach. That's not an allergy. Usually it's systemic, okay? So is it a true allergy? They're going to have hives, head to toe, or anaphylaxis. The whole body is involved with, the hives, or breathing, swelling of the their tongue, and not being able to breathe. So their lungs are involved as well, because they will start to basically histamine's getting released everywhere. I said this in the prior slide, amoxicillin, your allergy could be a cross reaction as high as 90%, but with cephalosporins it's less than 5. So this is the part I want you to know, because we're going to be talking about other antibiotics. And if you see one of your patients is allergic to amoxicillin or penicillin, we have to proceed very cautiously. Find out what kind of reaction did they have from penicillin. There's a lot of people that were told they were allergic to it, but they don't know even what medication it was. And this is usually like the older patient, like 70 years old. They don't even know what medication it was. And it went in their chart, and it's always been in there. So we have to do a little research. So let's move on. We have next up Ultram. What do you see right here? A C with a Roman numeral 4. That's a scheduled substance, isn't it? All right, so tramadol is a generic name. We don't even sell Ultram anymore, just so you know. It comes in a 50 milligram, it comes in 100 milligram, and it also comes in extended release. It is it's the mildest opioid narcotic. Still an opioid narcotic. And it's a pain reliever, of course. So it is chemically similar to codeine, and side effects, as you would imagine with all of the narcotic pain relievers, is going to be drowsiness, respiratory depression, and the potential to be addictive. All right, so next is Singular, also another one that is almost entirely generic. Montelukast, say it with me. Montelukast. Used for asthma, and it's also used for allergic rhinitis, which is seasonal allergies where your sinuses are affected. And it comes in a chewable for children, and it comes in a higher dose that is not chewable for adults. Now, if it's being used for asthma, it works better at bedtime. That's because of the way our bronchial asthma kind of seems to overnight constrict, and kids wake up with the asthma symptoms overnight. So bedtime dosing is better. Even though it lasts 24 hours, its peak is at 4 hours. So bedtime dosing for asthma. If it's for allergic rhinitis, time of day doesn't matter. Just needs to be consistent. Okay, so there's a box warning. This box warning only came out a couple of years ago. And it's kind of frightening, actually, because this medication used to be so widely used, and kind of makes me wonder if this was possibly the cause of some of the, I guess, behavioral problems in children. I don't know. That's just something a correlation that I kind of wonder about. So serious neuropsychiatric events. So aggression, small children just being super angry, and maybe it was due to, maybe it's part of the boxed warning. So it's very interesting. All right, so let's move on. Know your boxed warnings, okay? So Deseril, brand name for trazodone. And I put insomnia first, even though this was primarily for depression. Right now I see it because it causes so much drowsiness. They just use it for insomnia. They use it for people who have trouble falling asleep. And it does have SSRI activity, selective serotonin reuptake activity. And I want you to also know, I put this in here, 5-HT, because you may run across that a lot. That abbreviation stands for 5-hydroxytryptamine, and that is the fancy chemical name for serotonin, which we manipulate a lot with our pills. This should be taken with food. For insomnia, it works in 30 minutes to 2 hours of taking it. Okay, and then for depression, like all the SSRIs, and it's not really a true SSRI because they're actually not sure how this works, but they know it does cause more serotonin. Takes a couple weeks for effect and takes even longer for full effect, maybe 2 months. And like anything with the SSRIs, boxed warning, suicidal risk in young adults and teenagers. Bupropion is next. I guess I got everything up on the screen all at the same time. Brand name is Wellbutrin XL. And this is our last slide. Let's see. Norepinephrine dopamine. It's another serotonin in our brain reuptake inhibitor. So NDRI. And this is very, very, very important. If the person is an epileptic, that's a person who has seizures, this is totally contraindicated. So that is a pearl right there. Save that information. That could show up on one of your tests. It's also used for smoking cessation because it helps to decrease cravings. And it has that same boxed warning. Now, this is the last slide. This is also very important to know in practice. These are all the Wellbutrin or bupropion pills. We have 75 milligrams and 100 milligrams. Now look, we also have 100 milligrams again, 150 milligrams and 200, and these are SR, sustained release. Okay. Why? Well, what they did was they first came out with this at 3 times a day. Then they came out with this at twice a day. And then they came out with this at once a day, 150 milligrams and 300. So we have the potential, and I actually see this usually a couple times a week. I see this mistake. 150 milligrams XL ordered BID. It's totally unnecessary. And in most insurances will actually kick it back. They won't pay for that. Or I see 150 milligrams, 1 POQ day, once a day. No, the SR is twice a day. And the XL is once a day. Okay, so that's the take-home message from that. And so that's that. Let's move on to the next one when you're ready.